Start with a question that we do get a lot of, and we've seen it happen a lot over the last 16 or so months. What happens if an employee tests positive or has been exposed to the virus?
Yeah, and this is a question that we are continuing to get even all this time later, and this is another one that hasn't really changed since we first started talking about this. So when an employee has symptoms, or they test positive, or they may have been exposed, they should be sent home immediately and instructed not to attend work until either the 14-day quarantine period is over, and of course they don't have symptoms, or they obtain a negative COVID 19 test and can present that to the employer as evidence that they are no longer at risk. And important to keep in mind that employees who are at home due to COVID-19 exposure are entitled to take infectious disease emergency leave. So infectious disease emergency leave still around, still exists, still there to protect employees who cannot attend at work for whatever reason. The other thing that's changed in respect to infectious disease emergency leave is that as of April 29th, employees in Ontario are entitled to up to 3 days of paid time off. And that can be in order to get a COVID test, if they're awaiting results of a test, if they're sick, or if they are getting the vaccine, right? So that is something new that is recently available to employees that didn't exist when we were first talking about this last year. But in terms of the general procedure, basically, it's the same as it's always been, which is you do have an obligation to protect everyone else in the workplace, including the employee who's been exposed. And the best way to do that is to send them home as quickly as possible. So in terms of tips for employers, I think, again, really important to remember that you do have a duty to ensure a safe workplace. If an employee tests positive and they've been in the workplace, you kind of need to think about, is there anyone else that could have been exposed that this person interacted with while they were here in the workplace? They may also need to quarantine and get tested as well. I think one of the most helpful things that an employer can do for themselves is, if they don't already, have a clear workplace policy dealing with COVID-19. And the purpose of this is to make sure that everyone understands what their obligations are and knows what to do in the event of an exposure. So they know not to come to work if they're not feeling well, right? They know that they have to report immediately if they start developing symptoms. Having a clear policy, making sure everyone is familiar with their obligations, is going to make this whole process run a lot smoother.
Yeah, makes a lot of sense. So let's shift over to vaccinations, because that is probably the biggest change since our last guide to getting back to work, and it's also the area we get the most questions about. So the typical question is this: if my entire staff is vaccinated, do I still have to follow COVID protocols?
This is a great question, and actually one that really surprised me the first time that I received it, because frankly, nothing has changed, right? None of the directions that we are receiving from public health authorities is suggesting that having vaccinated employees, whether it's all of your employees or the majority of your employees, doesn't change what your obligations are or what the recommendations are in terms of ensuring health and safety in the workplace. So for now, it's business as usual. This could change, right, as vaccination numbers continue to go up, but for now, masks are still required, screening is still required, social distancing is still required. It really truly is business as usual. Now, we are already seeing some changes. So, for example, as of June 30th, the screening requirements for workers have changed. And most of these changes center around recognizing that people can have symptoms after they've recently been vaccinated. So the screening adjustments now allow for people to say, you know what, I am experiencing symptoms, but I just got vaccinated and the symptoms have only started arising since I've been vaccinated. Those people, it's safe for them to still enter the workplace. Right? Same situation where if a worker is living with somebody who is experiencing COVID-19 symptoms, but that employee is fully vaccinated, they're also able to enter the workplace. So we're seeing a lot of adjustments to screening requirements to recognize that the situation is evolving. So I think that's a really positive sign that things are moving in the direction where we are making adjustments. We can be less strict in terms of controlling entry into the workplace, but that doesn't mean that the floodgates have opened and we can go back totally to normal if staff are vaccinated. So in terms of tips for employers and for employees, I think it is really important to regularly check in with provincial and local guidelines to see if there's any changes. It allows you to kind of stay on top of what's going on, and kind of get a heads up if things are going to start to change in the future.
Yeah, and I think that's a great tip, not only for the employment context, but just socially, because I don't know about you, but I find, we're getting together with friends a bit more often lately, but nobody knows what to do. Can we go over and shake hands? Can we hug? Do we have to be distant? Do we have to be masked? And then you see people, pictures of friends on social media where they've had guests over and, they're right next to each other, and you kind of cringe and wonder if that's okay. So we're all trying to figure it out. So that's a great tip. And I guess the one thing I'll add, because I think we've said this in the past, which is the guidelines are really important and really helpful. They're not laws. So just bear in mind that you don't necessarily have to follow them to the letter, but if you don't follow them, you may have to explain why at some point. So do that with caution. The next big question, which we've talked about before, but things continue to evolve. Can you require that your employees be vaccinated?
Yeah, this is like the number one question of the hour. And this is where I get to say our favorite line, it depends. Now, when it comes to vaccinations, what we're really doing is we're balancing competing interests. So we've got interests of health and safety, we've got employee privacy, and we've also got human rights, the duty to accommodate. So we have to keep in mind still that the COVID-19 vaccine is not mandatory at this time. It's still an elective medical procedure, and employers are generally not entitled to detailed medical information regarding their employees, and they're certainly usually not entitled to dictate that an employee take a medical procedure or engage in a medical procedure. So while employers are entitled to things like information about restrictions and limitations, they've never been entitled to things like diagnoses or medical history or things like that. So the idea that you can require somebody to get a vaccine and then disclose to you that they've received a vaccine is quite extraordinary. Now, I think the other thing that we need to keep in mind is that some employees may not be able to take the vaccine for legitimate reasons which are protected by human rights legislation. So, for example, some people may not be able to get the vaccine due to disability. They might have an allergy to some of the compounds in the vaccine, or it might be for religious reasons, right? These are going to be grounds that are protected by human rights legislation and where a duty to accommodate is going to be triggered. If an employer is going to require the vaccine, they're likely going to have to justify that encroachment on the employee's privacy rights, and potentially also on an employee's right to be free from discrimination in the workplace. So the question that I always like to ask is there no less intrusive method which can ensure health and safety in the workplace? And I think most employers would be served by asking that question. Now, this is going to be challenging when you actually do ask that question and you answer it honestly, because it's been a year, more than a year now, where we've been managing health and safety risks for the past year without vaccines, right? So think about, what have I been doing to date to ensure health and safety? Is that still an option to continue doing that? And will that achieve the goal of health and safety even without vaccines being a requirement? So, really long way of saying it depends. It really is going to depend on your individual circumstances as an employer. And there absolutely will be businesses and employers that can require vaccines. Where the safety need is great enough that it basically outweighs any of the other interests that we were just talking about, then it's probably going to be permissible. That's probably going to be something that courts or arbitrators are going to be sympathetic to. But as a default, I would say most businesses are probably not going to meet that threshold, or a lot of businesses are probably not going to meet that threshold, and shouldn't assume that they have the right to require vaccination just because they want to. So in terms of tips when it comes to vaccines, what we have been recommending to our clients is that you encourage your employees to get vaccinated, not require it, but encourage it. And there's lots of ways that you can encourage vaccination, from the very simple, just making it a kind of a culture of the workplace, that this is something that you're encouraging, that you're supporting, to more substantive efforts like offering bonuses or gift cards to celebrate people who are willing to get vaccinated and willing to share that information with you. Or just making it easy for employees to take time off when they need to go get vaccinated, and not kind of throwing up roadblocks for people who would like to get vaccinated.
Yeah, I think that's really important, and we've worked with a lot of clients to do that, and a lot of them have adopted that approach of we're not mandating, we're encouraging, which I think is really helpful. And I think you made a really key point, which is that there is no one size fits all, and it's going to be a lot easier to justify mandatory vaccination in a healthcare facility than to take the extreme than in a workplace where everybody's working from home anyways. So you've got there is no one size fits all, and anybody who says that there's an absolute right to mandate is wrong. Anybody who says there's no right to mandate is wrong. It's going to depend.